I've always been very active in my life, been involved in sports as a young man and then later on in my life. And I started noticing some problems with my distance vision, lack of clarity, blurriness, and then in driving at night, lights would show up with a halo around them, and generally my vision was degrading slowly but surely. It was a slow process, but in talking to Dr. McHale, he had picked up the fact that I was developing cataracts early stage, and as it got worse, we discussed opportunities that I might have to improve my vision, which ultimately led to the decision to put new lenses in, and it's worked very effectively.
I'd say the most common misperception or misconception about cataract is that it's a film on the surface of your eye. Lots of patients think that, and they kind of think we just sort of peel the film off their eye and they're fine. Of course, a cataract is not a film on the surface of the eye. A cataract is a cloudy lens inside of your eye. So when we're born, we have a lens that sits right behind the colored part of our eye. It's right behind the iris, and it's a three-dimensional object. It is a lens. And as we go through life, in every one of us, that lens starts to become cloudy. It starts to turn kind of yellowish white. And as that lens gets cloudier and cloudier, our vision gets blurrier and blurrier. So to fix that problem, we have to remove that three-dimensional object. And then fortunately, we have great lens implants that replace it. So we replace that cloudy lens with a clear one. And not only is that lens clear, but it also carries prescription power. So we can drastically alter the focus of the patient and obviously to improve their focus.
Well, I have a condition, or had a condition, in my right eye. I have an astigmatism, and my left eye simply needed corrective to correct my vision. And as we were discussing the options, and again in consideration of wanting to maintain an active lifestyle, to be able to see items far away, in the case of playing baseball, to be able to see the ball off the bat, and also to be able to read, hopefully without the use of glasses. So in my right eye that has an astigmatism, the lens was replaced with the toric lens, which is designed for astigmatism, to correct astigmatism. And the left eye is a corrective lens. And it's interesting because I now have a distance eye, my right eye, and a reading eye, my left eye. I learned during the process that you don't see with your eye, you see with your brain. And my brain has accommodated the different signals from the two eyes so that I don't close one eye to see a distance or close the other eye to read. My brain processes that for me, so miraculously I think I have two perfect eyes.
The surgical techniques we employ to remove cataracts today have changed greatly over the past several decades. Part of it is with the equipment that we use. It has just improved significantly. Part of it is also the surgical technique that has been honed over decades of eye surgeons. The surgical times have gone down from a 45-minute to an hour procedure to a 10 or 15-minute procedure. Patients walk in, have the procedure done, recover for a half hour, and walk out of the center. Today we generally don't use a single suture because our incisions are so tiny. We're talking about 2-millimeter incisions that they can heal on their own without the need for suture. So it also, again, it adds to the patient comfort, adds to the quick recovery, adds to improved vision. So all these things make today the best time in the history of man to require an eye surgery.
It really is almost a business decision that you have to make. Do you want to invest in your eyes, or do you want to continue to have to use glasses and everything related to them? You know, the lens cleaner, having the glasses themselves. Because I also have glaucoma, I was pretty careful about my eyes, so I had not only transitional lenses, but also progressives. So I had probably the most expensive glasses that you can get at $400 or $500 a shot. The business side of the analysis is that in about 3 years these lenses pay for themselves, and for the rest of my life, assuming everything, I can take care of my eyes as I have been, I'll never have to wear glasses again. So from that standpoint, it was terrific. And the other side of it is the pain of carrying glasses and losing glasses when you're traveling, or as I do, step on them or sit on them. I don't have that pain anymore. And it really is liberating not to have to carry your glasses around and to wear them. I have 20/20 vision, and I really have no limitations whatsoever.
Or I have very high expectations for my patient outcomes, and in the business we always want people to see 20/20 after we perform a procedure on them, and fortunately that's really what I've come to expect. The vast majority of patients that have this cataract procedure, if they have healthy eyes otherwise, are seeing 20/20. And when they come in a day or a week after surgery and they read down that chart all down to the 20/20 line and they do it without their glasses, I'm not sure who's happier about that, them or me.
This has been, to me, it's been sort of a life-changing experience to have impaired vision and then suddenly to have vision like a 20-year-old again. When we moved to Dublin in 2006, I'm not sure why we chose Dr. McHale and Columbus Ophthalmology, but it was a great decision. For me especially, also for my wife, but for me because of some of the conditions that developed after we came here, I couldn't have been in a better place. I've said before that my decision to put new lenses in was life-changing. I don't know that I would have made that decision had it been with another firm, someone who took the time to walk me through it and understand it. It's a process, and they were very helpful in that process. So I'm pleased to be able to be with them. I will continue to be with them, and now that I have perfect vision again, I intend to maintain it that way, and I'll do it with Dr. McHale and Columbus Ophthalmology.